Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, we are really excited to have you here. Welcome aboard. And we're excited because we're having some just really fascinating conversations with some tremendous leaders that are painstakingly reshaping the future of healthcare. And we're really passionate about a few areas. We're passionate about access, leadership, innovation, and innovation adoption. And if it's your first time tuning in, let me just sort of take a quick step back and tell you really what we're trying to get done here. So, our focus is on bringing real stories of innovation to life, not just theories, but things that are really happening, highlighting real people that are really innovating within our space, giving them the opportunity to share their stories with our community and ultimately with the world. Got an amazing action packed here. If you haven't checked out any of the historical interviews that we've done before, wherever you are, if you're watching this, if you're listening to this, hit the subscribe button now so that any new interviews come directly to you. And our next guest is someone who's not just talking about equity, she's really building the scaffolding that makes it real. So Dr. April Joy Damian is a psychiatric epidemiologist. Try saying that 10 times in a row. She's a health services researcher, a classically trained public health professional whose work really sits at the intersection of research, policy, and access. So she serves as the vice president and director of the Weitzman Institute, a national engine for innovation in primary care for the underserved, and is also a senior scholar for health equity at AcademyHealth. She holds a faculty appointment at Johns Hopkins. And I think what makes April Joy different is how she blends evidence and empathy. So whether she's advising national academies or shaping national strategy for the NIH's Recover Initiative, she's really earned a reputation as one of the most trusted and, quite frankly, respected voices in the field of health equity. So she's helped lead groundbreaking work on social determinants of health, push forward new quality measures for the National Quality Forum, and continues to be a sought-after speaker, teacher, and a thought partner. So this isn't someone who's just shaped policy. I mean, she's really carrying the voice of underserved communities into the rooms where decisions get made. And quite frankly, she's just getting started. So April Joy, it's a pleasure to see you, have you on the show. Welcome to the show.
Thanks for having me, Michael.
All right. So maybe can you take us back to a moment of growing up? Maybe something you witnessed or experienced. What were the first sort of planted seeds for your passion, your mission around sort of equity and health justice?
Yeah, no, appreciate the intro and again, appreciate being on the show, Michael.
Of
I
course.
remember growing up in San Francisco. So I'm the daughter of immigrants. My family's from the Philippines and Spain. And my father came from a working class background. Eventually became a chef in San Francisco, but you could tell that he was suffering from different mental behavioral health challenges because of,
Hmm.
I would say, which I didn't understand then, but saw that he would cope. He would have maladaptive behavior in terms of coping,
Mm,
whether it be drinking or not eating nutritious
mm,
foods, um, or isolating himself at times. And
right.
I didn't really understand. I thought my dad was just doing this out of neglect of his own health, um,
Mm,
that he was pouring out from an empty cup, so to speak.
mm,
I soon learned, so fast forward to undergrad, and I became an ethnic studies major at Berkeley. So I learned about
hmm.
race, class, and gender studies. I
Right.
learned about, I realized it was on my campus at Berkeley where the phrase social determinants of health or social drivers of health was first
Hmm.
coined. And I realized that, the stresses of being an immigrant, of speaking English as a second
Hmm.
language, of being away from your homeland and trying to, quote unquote, pull yourself by your bootstraps and make it in the
Right.
US could have contributed to the stresses that my
Mm,
dad had that I witnessed growing up, much of which he had no control over as much as he worked hard.
Right.
And so I think from there, recognizing the intersection of what we now talk about social drivers of health or social determinants
Hmm.
of health, and how these upstream factors beyond clinical practice impacts one's health,
Hmm.
not just in terms of access, but also choice and opportunity, and eventually outcomes. And so I knew then, seeing that, and then seeing that it wasn't just my father, noticing that, oh, parents of friends in my neighborhood were also going through the same thing.
Yeah.
Learning more about the history of what my ancestors went through, right, in similar
Yeah.
situated communities. That I no longer have to see my father in isolation or blame him,
Hmm.
but really recognizing these social root causes. So I would say that witnessing that growing up really left a mark on me and what I eventually decided to pursue.
Yeah. It's amazing. Being the son of immigrant parents as well, there's a lot of stuff that you experience and you see. And just for me, from what I'm noticing, is that what was once way back when is I thought it was a disadvantage. I think now has turned into an advantage for me just because it's given me a much greater perspective. You mentioned Berkeley, and my thought kind of goes to that. I mean, you've walked the halls of Berkeley, Harvard, Johns Hopkins. It's impressive. And I guess maybe what's maybe a story from your time as a student? Maybe it was a mentor or a class or even a research moment that sort of shifted your perspective and shaped the work that you're doing now.
Mm. No, that's a great question. Um, so I will say I'll fast forward to from Berkeley to crossing over to the other side, the East Coast, and Hopkins, because I think Hopkins is really where I was able to have it was a culmination public health of my training in ethnic studies and being in the West Coast
Hmm.
in Berkeley,
Hmm.
and then being behind the crimson curtain at Harvard. All right, having these two worlds and being trained in medicine, being able to bring that to my public health training. Um, it was really my first year at Hopkins. It was the Freddie Gray tragedy and the Baltimore uprising. Um, in response to, and it was the rise of the Black Lives Matter movement that was happening,
Hmm.
all within my first year of my graduate studies. I was introduced to Dr. Lena Wen, who at that time was the health commissioner of the Baltimore City Health Department.
Hmm.
And then fast forward, I eventually started working under her and was looking at um, training the all of Baltimore City government workers in trauma-informed care.
Hmm.
SAMHSA at that time, um, they were doing training technical assistants around the country. And one of their consultants, also PhD trained, was saying, April Joy, have you thought about your dissertation? Like, it's just my first year. She said, why not turn evaluation of this program, which has never been formally evaluated, aside from the anecdotes that we get
Hmm.
from participants, that it was a great experience. And so I think that was really the turning point because, I knew I had to go back and get a terminal degree. I knew I was and still am passionate about mental health, but then in allowing research to be that conduit between what communities need and how my research can better their lives. But the idea of being able to translate research to policy was
Right.
something that just clicked then of like, oh, you mean it's not just going to be a dissertation that collects
Yeah.
dust in our library, but actually something that can help improve lives, not 10 years down the line, which is
Yeah,
really what it takes. There's usually a 10-year gap between
that's
research
right.
production and translation. They're like, no, like this can actually make change. And now we see the Elijah Cummings Healing Baltimore Act, which now it's not since enacted under Mayor Brandon Scott. So now it's all government workers in Baltimore City
Mhm.
are mandated to be trained in trauma informed care. making Baltimore the first city to ever do that in the US. So it was really exciting to have
Mm,
that experience of, yeah, it's not just about publishing that paper.
right.
It's not just about earning a degree and adding more letters after my name, but really how do we change systems through creating evidence that is both scientifically rigorous, but also culturally relevant.
Yeah. You said a few things that triggered a few different thoughts in my mind. Um, and just your tours of duty that you've done, fascinating because you're trained in both data and the human condition, and from psychiatric epidemiology, health equity, mixed methods. I'm just curious, was there ever like a moment when the numbers pointed one way, but like a patient story or like a personal experience, you know, made you kind of rethink your conclusion?
In terms of a conclusion from my research,
Yeah, just did those sort of intersect? Did they intertwine? Did they sometimes deviate from one another? Um, just because you're
yes,
dealing with people, but sometimes data tells you something different, but you have a personal story that resonates. Maybe it triggers something from your past and you hold on to it and it triggers a thought of some sort. Did at any point those two things, the data and the personal stories, did they either intersect or did they uh,
yes.
completely go opposite directions?
So I'll have to, Michael, do a shout out to one of my, who was one of my advisors when I had a NERSA grant at Hopkins, and to this day is a lifelong mentor, Dr. Joseph Gallo. And this is the same research project, right? In the SAMHSA's Trauma Informed K training program.
Hmm.
There were a few responders who said, the training did nothing for me, right? So,
Hmm.
so extreme. I'm like, oh, 9 months of doing this and nothing. Then you get into the interviews, right? And so sometimes, if they answer surveys a certain way, it can skew the data, right? Not to get
Right.
nerdy on you,
Right.
Michael, but
Yeah.
then it can
I love
affect the
geeking out. Let's geek
p-value and
out.
the significance, and then you're like inconclusive or not significant, right? I
Right.
was doing mixed methods, which means I was also doing interviews. So I was
Hmm.
collecting qualitative data. So Dr. Gallo challenges me. He's like, look at the qualitative data, right? No, don't just come to your conclusions after having, and Hopkins is very quantitatively oriented. I think
Hmm.
it's shifted a bit, but very strong
Hmm.
quantitative research training. Anyway, Dr. Gallo says, look at the qualitative data. Fine. And read the
Okay.
interviews. One of the interviews was from a 311 operator, so dispatch.
Hmm.
And she was saying, you know what? My whole family's had trauma. We're used to violence. It's not just
Hmm.
me, it was my mom, my mother's mom. And so
Right.
this really doesn't do anything because at the end of the day, my life is still the same,
Mm.
right? And so Dr. Gallo, being a clinician by training, very seasoned clinician and researcher, saying, what does that say? And saying essentially normalizing trauma, right?
Yeah, I
Just
was like, it's
change.
desensitized to it.
Yes, desensitize, exactly, which is what I used in my paper. So they've been desensitized. So it's one of those, it's beyond the training,
Right.
right? And then it brought me back to going back to my father, right? And growing up and mental health being stigmatized. We don't talk about mental health, behavioral health.
Hmm.
Um, and the idea of, oh, some of these concepts or challenges seem so big that people have just found their own ways to cope with it, be desensitized, as you've shared, or normalize it. And
Hmm.
here we're
Hmm.
saying, no, it doesn't have to be that way. We can introduce a new way and we can change or challenge structures or policies that aren't working for us. So I think that
Mm.
was a really big moment of knowing the kind of information and that I can glean from qualitative that may be missing from quantitative. So not always just relying on the numbers,
Right. Right.
but also listening to stories of people on the ground and really questioning the results all the time. So yes,
Hmm.
that was one that really stood out of, okay, don't be so quick to come to,
Mm,
my own conclusions and take the easy route as a researcher, so to speak.
right,
But keep,
right.
um, stay curious.
Stay curious. Yes. Uh, I want to switch gears for a second because for those that I guess have never heard of the Weitzman Institute, um, tell us a story. Like, can you maybe walk me through an example of an innovation you and your team rolled out that reached someone that the system had forgotten, and what happened next? Like, I always like to do things where you can kind of frame things into stories. Does anything come to mind for you?
Yes, so I have several stories at Weitzman that keep me up at night, but also keep me motivated to keep moving forward. So if I'm
Yes.
Michael, I know you shared in the beginning of our chat a little about Weitzman Institute, but we're essentially a research education policy institute focused in the primary care setting. So we serve over, well, actually, last year was over 40,000 healthcare professionals in 1,200 health centers across the country,
Mhm.
all 50 US states, DC, Puerto Rico, Guam. So in total, those providers then serve over 2 million patients nationwide. I'll give the story at our latest example that I have is from one of the programs and research projects that I was the PI of, was funded by the Singer Foundation, where we trained youth who've experienced trauma and have been exposed or are at high risk of exposure to violence in restorative justice and mindfulness.
Hmm.
So they go through this 10-week program. I met with them at the end. Um, and it was one of those, um, the odd couple. It was like a bunch of kids. You're like, how do we put these
Yes.
people
Felix
together?
and Oscar.
Yeah. And they're like, I don't know who put these kids together because you could tell they were part of, and I do a lot of my research mostly with youth and adolescents. And
Hmm.
I'm like, these people don't seem like they would hang out together in the playground, right? It was like the
Right.
cool kids, the nerds, those are more introvert, the wallflowers, right? But then the sense of community that they've built. And one of them had shared, in school they wouldn't have never paid attention to me. They wouldn't have even said
Hmm.
hi. But here I'm becoming friends with people I never thought I would become friends with. And I feel really safe here and rather be here than be at home, right? Because I really
Wow.
feel like I belong here and I'm seen.
Wow.
And so that was really challenging for me because, for me, I grew up in a household when I was new. I knew I was loved and cared for and could always come
Yeah.
home. But to think someone in their formative years is like 12, 13-year-olds saying this, you see nodding heads. You see how they start looking out for each other. So the cool kids are like, yeah, that's my friend. I joke around with that person, but yeah, no, I would look out for them now, right? And
Yeah.
so I think, and to know that was only a matter of, it was a small grant. It was still generous, but small grant nonetheless. And it was just 10 weeks with each other. But to know that in a safe, supportive environment, we can create those kind of connections that may not have
Hmm.
otherwise been developed organically in the school setting where they face all kinds of pressures, right? And like I don't envy them
Yeah.
in terms of the society that they're growing up in. So I think that really stood out in terms of why we do this work, why it's needed to build the evidence base for strength-based approaches, right? And
Mm.
then how do we support youth mental health in ways that build on the strengths they have, right? Because we gave them some tools, but
Right.
they really built
Right.
their own connections with each other.
So what happens after that in that initial kind of cohort comes together? Is there any follow-on? Is there communication that happens thereafter? Is there sort of some things that happen longitudinally?
Yes, so we followed up 3 months later, so that we what in research called the maintenance period, right? Was it
Right.
just a because we want to say, was it just a feel good, and then
Yeah.
afterwards they just
Yeah.
parted with their ways, and they actually maintained. It says they were able to maintain both the practice, but also those relationships. We followed up 3 months later. But then, right now, we're in the process of trying to find funding to continue to find these types of programs, because we find that the need is much greater than funding that we have and programming that we're able to provide. But yeah, they were saying, sign me up if there's another program, if there's somehow I can, be one to vouch for the impact the program has made for me, if, should we come across potential funders. So we definitely want to stay connected. It's just a matter of finding the means to make it happen.
Yeah, because and Weitzman, forgive me from incorrect here, but you operate at a national level, right? And
Correct. Yes. That's just one example. And we're
yeah, yeah, but what's interesting is that it's grounded in like real local community.
yes.
Yeah. When you think about what you're doing, because you're at sort of the intersection of research, education, policy. You, when I think about that, like those worlds don't always speak the same language.
Mhm.
Um, how do you find alignment within those three areas? Is it mostly down to individual skill? Is there something that you do to kind of bridge those silos? And, I guess what have you learned in the process?
Yeah, great question, Michael. And I would say each of those also have their own culture, right?
Yeah, there's some subcultures, yeah.
Which I've learned and have grown from as a result of saying, how do we break down silos between these? Because then I would add the fourth is clinical practice, right? And it's like, oh, also different training, different culture. Um, I think it is the reason why we have shared mission, vision, and values.
Yeah.
And then knowing that comes first and foremost is our guiding light in our work.
Hmm.
And that the research, education, policy, and I mentioned before, the clinical
Hmm.
practice, which is clinical colleagues, that is secondary. That is the how, right? Our why and our what, we're a united front when it comes to that.
Right.
And I think being able to approach it that way, right, of being able to say, we all offer different pieces here, right? If you think about, I know we're not, I don't like give sports analogies, but
Mhm.
um, Michael. So I'm currently watching Making the Band. Don't or Building the Band on Netflix.
Okay.
I promise this relates. But essentially, one of the mentors slash judges was saying a band works when everyone knows their role and embraces that role and is able to provide feedback to each other to make the other one better.
That's right.
Right. And I think
Hmm.
we're our own band, we're our own sports team, we are a team. And so knowing that, what, the education folks, they're really great at knowing how to put together curriculum,
Hmm.
how to approach clinicians, but also have um, allied health professionals and patient partners engage in those
Yeah.
conversations together. So it's that power dynamic is minimized, right? But also, how to improve patient care that way. Researchers, they know how to build the evidence base, they know to like quickly and thoroughly look through what exists, where are the gaps, and then be able to package it in a way that the education folks can use it and disseminate it, right? And the policy, they're able to translate both, right? Of saying this is what our workforce needs in terms of training and
Yeah.
technical assistance. This is what research needs to be able to drive impactful,
Hmm. Hmm.
action-oriented research, right? And so knowing that each piece is not more important than the other, but really
Right.
helps inform and better the other. And so I think that's only made possible when you go through the pain of revising a mission and the vision, and priorities, so you know how like you're really working together.
Mm.
So yeah, building the band was a very helpful reminder of like, yeah, we're building our own band here at Weitzman.
Yeah, it sounds like what you pointed out is, hey, let's find common ground that we all can agree on. And when you mention about why are we doing this, what are we doing, it's easy to find alignment around that and building around that. And then, yeah, I think about it as it's like a beach ball,
Mhm.
and they're different colors of the beach ball, and you're all still in the beach ball, but you're just covering different surface areas of the beach ball.
Yes.
So fascinating. So, I mean, look, you've along those lines. I mean, you've sat in some pretty important rooms as it pertains to, policy in the country, NIH and QF and like other things. Um, Maybe take us into one of those rooms, into some of those moments. And you seem to me to be someone that speaks truth and like say it in a very authentic way. What are those rooms like? And talk to like just help someone see inside of those rooms and what is that like?
Mm. We're being recorded right now. Just kidding. For me, I think I'm filled with excitement when I enter those rooms, right? Because when I see different stakeholders, I try to find, you're talking about common ground. I think about
Yeah.
commonalities, right? Usually when I enter those rooms, there is um, a common theme or goal that we're working towards, right? And like
Mm.
each person, often those rooms that I go into that you're talking about, they include representation from payers, so like health insurance companies,
Yeah.
providers,
Right.
folks in academia. They started to sprinkle in patient and community members, right? And I love the storming and norming that happens because you see like all of these people who are so passionate about the same topic, um, and really want to get their point across. Um, wanting to do better, right? Like I find myself, I think with the common ground is being able to see people who just want better, right?
Yeah.
Want better for
Yeah.
their
That's right.
patients, want better for their clients, want better for their families. Some of them want better for themselves, right? As patients or even as caregivers, sometimes have been in the room. I mentioned patient partners. Um, so I think it's really exciting because for me, I've occupied many of those stakeholder perspectives, right? And sometimes you
Hmm.
find people that are just one track. I am defending my stakeholder group,
Yeah.
and it's at the cost of this other stakeholder. And it's like, winner takes all, not that we can all
Yeah.
share a piece of the
Yeah.
pie.
Winner loser type mentality. Like, we need to
Yeah.
win at all costs. Right.
Yeah. So it's great when I'm able to bring different voices in and create space to be like, great, we heard you. And how about we hear from this other person, right? Because I think in those spaces, I, I was very sly when I said sprinkled in patient community members because sometimes we schedule these meetings to our convenience, those who are in the healthcare field. And
Mhm.
it's like these patients, caregivers, community members, they have their own jobs and we've done it at our convenience. That's changing a bit. But to be able to, say time out, let's make sure our patient partners, community members also have a voice and then not just a physical presence in these spaces. I think it's one of those full circle moments of like, oh, like I'm now in a place to be able to take up space, right, and create space
That's
for
right.
that.
That's right. When we talk about primary care innovation, especially those that are underserved, I bet a lot can come to someone's mind. But when it comes to innovation, is all about momentum and where can we find little wins? Where do you see white space where there can be little wins, for primary care innovation? Where do you see that happening within the next 6 to 12 months? And where do you and your team, where do you place your focus and are placing your bet?
Yes, so I am trained as a psychiatric epidemiologist, which means I focus on mental health of populations. So that I know that's a mouthful, and you were saying very hard to say in 10 times. You're right, Michael. Uh, but I really think right now we've reached that fork in the road in terms of addressing mental health.
Hmm.
Um, Before, when I would say primary care, people only think medical, and now
That's
people are
right.
coming to think that, oh no, primary care is like integrated medical, behavioral. Hopefully, we can come to a point where we're also integrating oral health, all right, and pharmacy, which, at our health center, we have all four work together very well and integrated. But I realize can't take that for granted. But I think because of the mental health crisis that we find ourselves in across the life course, right?
Hmm.
From the very young to the very old and everyone else in between. Um, I think it's a really exciting time because it's one of those everyone can be in agreement that mental health affects all parts of our life, whether it be
Yes.
academic performance of kids to workforce productivity and absenteeism to the high costs of end of life care and those who are suffering from loneliness and
Yes.
other mental health conditions later in life and not being able to age with dignity. um, so I think it's really when you have, again, going back to not just the how do we do it, right, research
Hmm.
education policy, but the why and the what, um, to have that kind of understanding, not just those of us who are in academia or in healthcare, but even society as a whole, I think is a really exciting time because now we can do something about it, right? My coach
Right.
says consciously incompetent. So now that we've been conscious of the gap that exists and that we have not addressed,
Yes.
now we can do something about it.
Hmm. Yeah, there needs to be the awareness that needs to be built
Yes.
up. What is the most misunderstood, I guess, idea about health equity today?
About health equity.
Yeah.
Mm, mm. I think one of the challenges with health equity is that we're thinking it's just individual actors, like just a few bad actors or few bad
Hmm.
apples who treat people wrong and who just want to keep everything to themselves, right? Just in layman's terms,
Yeah.
right? I think more so here, we're not very good at understanding. And I don't think our American history courses um, in our school systems have done a good job at going over the history of policies and decisions that have been made way before us that have contributed to present day inequities that we see,
Hmm.
right? So it's not just individuals saying us versus them, even though that is, still exists. It's also knowing, no, there's these inequities that existed in
Hmm.
terms of who was even defined as being human, who had access to what or didn't have access, that continue,
Right.
that was then enacted into policy, right? And so without anyone doing anything, because it's already been enacted, right? There's no
Hmm.
further action needed. It's been enforced. How that continues to have consequences
Yeah.
even to present day. And so I think it's one of those sometimes you underestimate the impact of systems
Hmm.
and structures and policies on our day-to-day lives and just want to be quick to put a face or a name or a group and assign blame on either side, right? Of
Right.
whether
That's right.
you're the someone who's marginalized and how you're defining the oppressor, quote, or the oppressor then singling out a specific group or individual. So I think without that history, we're just quick to try to identify the enemy.
Yeah. I don't know. Something tells me that sometimes we've been hardwired to kind of go down that road, and it's going to take a little bit to rewire ourselves to not go down and point fingers and just, throw people in front of the problem. I'm curious, just because you deal with a lot of things, a lot of heavy things, and with everything that you're juggling, faculty appointments, policy work, like leadership at a national scale. How do you stay centered? Is there like a ritual or habit that you've implemented as a leader, to kind of continue to stay grounded and continue to stay centered?
Yes. So I'm like, um,
And I'll tell you why
I'm
I asked.
laughing
I'll tell you
because
why I
my
asked
coach and
that.
I talk about this of being the redwood, right? And I'm like, what am I deeply rooted in, right? And for me,
Yeah.
my faith is a big part of my life and my church
Hmm.
community. And so my husband and I are very active in our church. It's very social justice, community oriented, and just really so, so that is a big part of my life, but also surrounding myself with my own group of champions, cheerleaders, accountability circle, right? Those friends who will remind me of who I am beyond the work as much as
Right.
the work is my professional and personal in terms of my values, and the work I do is very overlaps a lot. The
Hmm.
um but knowing that it's okay to rest and it's okay to take a step back, and I occupy other identities as well. And so how am I nurturing those parts? So that's why I brought up accountability of
Yeah,
being
for sure.
able to say, you know what, sometimes, even the most seasoned athletes have to take a break, right?
That's
And
right.
so just knowing that rest is also active, right? And it allows me to
Hmm.
come back to this work stronger, more resilient. Um,
Yeah, there's something to be said about having an authentic community around you, like you said, a place where people know you, like they really, really know you, and
mhm.
they're in your corner and they got your back. That's always super helpful. Because in innovation, I asked that question because people think about healthcare innovation and think about the glitz, the glamour, and there's a lot of good that happens. But the truth of the matter is, it's a lot of hard work, and you're not winning all the time.
Mhm.
You're not winning most of the time. So that can be difficult to deal with. So I'm always just curious from a personal perspective, what do other leaders do? How do they, and it sounds like, surrounding yourself with other leaders, people that you can be safe with, that you can share stuff with, that can help you kind of fill your cup up. But also, if you're running on overdrive, they can tell you to take a break, and, you'll listen.
Yeah.
What else do we need to know about the Weitzman Institute? How can folks follow your work, the things that you and the team have been doing? What is the best way for people to keep tabs on that?
Yeah, so thanks, Michael. Yeah, they could either connect with me on LinkedIn. They could go to our website. So it's weitzmaninstitute.org, and it's not the Weitzman Institute. It's not Wiseman Institute, which we sometimes get confused with because they're
Yeah.
restorative research.
Weitzman. Yeah.
And we also have a following on social media as well.
Okay, great. And we're gonna do something fun right now because we always like to wrap things up on a fun note. So we're gonna do a little rapid fire questions in one sentence or less. So let's think about, one book that you read that has changed how you lead.
Mm. Now I feel bad, so sorry to the author, but I'm reading this book on insight.
Okay.
I think it's called Insight. Um,
Well, they're getting a free plug, so it's great.
yeah, they're getting a free plug. Teal covered. It's so bad. I mostly read papers. That's why I joke with people. I don't read books. I am reading this book. Um, so I think there's for a season I've been so externally focused, and this one is really saying, how do you look more within in terms of challenging your own assumptions, your own beliefs, not just about the world, the work, the people you work with, but about yourself
Mm,
and how you perceive others, how others perceive you. So I think it's one of those, um, it's great to be introspective, and have a stronger sense of self. So I then know, if someone or something irritates me, how can I approach it better? Because we were talking earlier before this about Viktor Frankl, but
Yes,
really
yes,
understanding, right, of like, what can I do on my side of the street and not be so quick to judge, get upset with, draw my own conclusions about this person's project. So I think it's been really helpful to just do the inner work so I
yeah.
can be better outside.
And what about most underrated leadership trait?
Mm, listening.
That's right. All right, last question, we'll wrap up. If let's just say you're sitting across from a young professional, they're bright, they're they're passionate, but they're a little disheartened um, by the brokenness of maybe the health system. What what story would you tell them to help them stay in the fight?
Oh, mm, so many stories, Michael. But like, which one do I choose? I'll choose. Um, I know it can be very hard for those um, who do direct patient care and clinical care.
Hmm.
Um, and I remember when I finally, I'm trying to normalize conversations around seeking mental health services. I finally sought therapy after my dad passed away and became the sole caregiver of my mom. And I think finally having someone to sit down and listen with me or listen
Hmm.
to me,
Hmm.
understand the grief and, help me process that grief, then allowed me to better focus on my work
Yeah,
and rediscover my passion and just put first things first and just get life in order, and then be who I am today, right? Numbers wise, like clinicians say, it was just one person. Um, I eventually went back to my therapist in grad school and said thank you, right?
mm,
And I think it's one of those, you think this is just one person in front of me, how can this really make a difference? And I think we always have to think, one day at a time, because you never know how this is really making an impact on this person, but also on
mhm.
all the lives this person touches. Right. And so I think, and maybe you might not see the fruits of your labor tomorrow, right? Just like a
Right.
farmer who sows seeds, right? It may not be harvesting season. It may take a while. There might be some external factors that affect the harvest. Um, and it might not be for you to see. It might be for the next generation to see, right?
That's
But
right.
just trusting that you do your part and, in the grand scheme of things, even if we don't see the fruits of our labor here, that hopefully are making a difference. So I think that's the story I would share because I think it's important not only to normalize seeking mental health services, um, but to know that it's not just about the numbers all the time, going back to what we were talking about, but trying to make a difference and make the most of each and every day. Because you just never know how that'll impact the future, not just for that one individual, but for
That's right.
generations to come.
Hmm. April Joy, it's been really fun chatting with you. It's been really fun. I think what
Likewise,
what
thank
stood
you.
out has been your level of authenticity, your sincerity, and you just want to make things better. So for those of you that um, have tuned in to this conversation today, if this conversation moved you, if it challenged you, or just made you think differently, please consider sharing this episode. And if there's a topic that you want us to explore further, or even a leader that you'd like to hear from. Yeah, drop me a note, leave a comment. I do read them. Remember, this platform, it's about community. It's not just content, but it is about building an authentic community. So thanks for listening. Keep building with purpose, and we'll see you next time in the next episode of the Advancing Healthcare Innovation Show.